So AARP was the one that does its designation. Boulder County was designated age-friendly back in July 2016. Previously, when we did our Age Well strategic plan, we had 4 quadrants, which were basic needs, health and wellness, personal connections and community involvement, and aging in community. Going forward with our new Age Well strategic plan process, we will be using the AARP domains to frame our future. Those include outdoor spaces and buildings, communication and information, housing, social participation, respect and social inclusion, civic participation and employment, transportation, community and health services. It's pretty wordy. All right, so a little bit about the CASOA. This survey was commissioned by the Colorado Association for Area Agencies on Aging. It was conducted by National Research Center Incorporated, and the Next 50 initiative is the funder of the statewide CASOA. So it was conducted statewide in 2010 and 2018. For Boulder County, it was conducted in 2010, 2014, and 2018. And there's also municipal level data that comes out of the CASOA as well. And in Boulder County, that includes Boulder, Longmont, Louisville, Lafayette, Erie, and Superior. Has anybody here used CASOA data in any of your strategic planning or just for fun? Yeah, okay, just a few folks out there. All right, so I'll be doing some presentations on municipal level CASOA data going forward to advisory boards, councils, et cetera. And if that's something you're interested in, you can find me later on here today and we can talk about that. But today I'm talking specifically about our countywide data. Just to tell you a little bit more about this survey too, there are 135 questions and there are 15 demographic questions. So there are a lot of ways to slice and dice this information to get at what you need. But today we're not going to look at those subpopulations at all. We're sticking to Boulder County and all respondents. And just so you know, people in long-term care and skilled nursing facilities are not included in the CASOA, but we have other ways to reach out and get information from these folks. The purpose of the CASOA is to identify community strengths and service gaps. When you're looking at the report itself, I strongly encourage you to check out Appendix A in the back so you can read specifically how the questions were asked and in what categories people answered. So it's a multi-contact mailed survey. The representative sample of 3,700 households of residents age 60 and plus, we got a 19% response rate, which is right in line what we're looking for. And there was a 4% margin of error for this year. CASOA is a statistically valid survey depicting the strengths and needs of older adults as reported by older adults. The intent of the survey is to assist organizations in assessing the services and resources dedicated to older adults. Let's move on. So here's just a few characteristics of what we saw with the CASOA. 61% of people had lived in their community for over 20 years. 19%, or about a fifth of the folks, had less than $25,000 for the annual income. The age distribution here matches what we see in Boulder County. So about 3/4 of folks are 60 to 74 years old, and those age 73 and over make up about 1/4 of our Boulder County population. So 58% of folks were fully retired. Of those who were not retired, they expect to retire at age 73. That's the average age for those who had not yet retired. Okay, data's dry. It really is. It's hard to share this, with different populations and making sure you get out of it what you need. I mean, it is really dry. It is difficult. So I want to tell you, with the CASOA, there's several different rating scales that are in there. They go from poor to excellent. There's some that talk about minor problem to major problem, no problem at all. I want to apologize to those of you who have young children, especially you, Emily. You are tired of seeing emojis. I am sorry, but that's one of the ways we're going to be looking at the data today. I do promise I will not talk about baby shark, which I have not Googled yet, and I will not be doing the floss dance. So we're just sticking to emojis. I want it to be, when you're looking at this data, that you feel zen, that you feel happy with the information that's being presented to you. As we're going through these, you can look at the emojis just to know if we're doing well or meh or not so well. Another way to look at this is the arrows that we have. So this will tell you year over year what we've seen in terms of change in each of these categories. And I also have the stats here as well, if that interests you. So it's kind of a choose your own adventure with data, this presentation. So we're looking at overall community quality here. One of the things not included in this graphic is community as a place to live, and that hasn't shifted much in the 8-year period from 2010 to 2018 for Boulder County. It holds as about 90%. Our overall quality of services, that has decreased, and our community as a place to retire has decreased, and remaining in community throughout retirement for folks has decreased as well. And by each of these, it's 11 points for our top one, 12 points for our middle one, and 11 points for the bottom one. So remaining in community throughout retirement was at 90% in 2014, but there's been a pretty large drop between those two surveys. So respect and social inclusion, this is one of our AARP domains. Neighborliness of community is really held steady over time. We'd certainly like to see an increase there, but this is where it is for now. Openness and acceptance of the community towards residents age 60 and older of diverse backgrounds has decreased over time. It decreased from 2010 to 2014, but has kind of held steady from 2014 to 2018. Social participation. So use a senior center in the community has increased. It's increased to 30%. And that's folks who have used it at least once in the past 12 months. One thing to know about this survey, I've listed this as a happy emoji because this question was to all respondents, and this doesn't necessarily bring it down to the folks who have access services for older adults in the community yet. So this is good. We're happy to see an increase in the use of a really great resource in our communities. Availability of information about resources and finding productive or meaningful activities to do has held steady over time as well. Okay, a little more social participation. There are quite a few social participation questions on the COSOA. So opportunities to attend events and activities. It's staying about the same, but we're really happy to see that it's at about 3/4 of our population are able to find those opportunities. Participating in rec program or activity. This is important to us because many of our senior centers too are housed in rec centers in different communities across Boulder County, but it is holding steady as well. Opportunities to enroll in skill building or personal enrichment activities has gone down, but it hasn't gone down a lot. So this one's just kind of, it's okay. For civic participation, volunteered time to some group or activity in the community, I'm giving this a happy emoji because we love that folks like to spend time in their community and give back. So we're happy to see that number hold steady, and we'd be happy to see it increase as well. Opportunities to volunteer, this is just a little decrease. Folks from 2014 to 2018 said that there were less opportunities to volunteer, but I would expect to see that change in our next round of surveys. So I'm going to talk a little bit about unpaid economic contribution. So we talked about those opportunities to volunteer, and that's really where this and caregiving are captured in dollars. So over time, this figure has increased for each of the surveys. And this is just taking the amount of time people say they spend in volunteering caregiving opportunities and putting a number to it. You know, what is this worth in our community? So our older adults provide significant contributions to the communities in which they live. In addition to their paid work, they contribute to the economy through these opportunities. The value of paid and unpaid contributions totaled more than $1.6 billion in Boulder County at the measurement of this survey, which was about July 2017 to June 2018. So people are still experiencing some economic hardships in our community too. Having enough money to pay for their property taxes and having enough money to meet daily expenses and dealing with financial planning issues. You know, it's about 1/3 of folks across the board are experiencing these issues, and this is something that we'd like to continue to address going forward. Okay, housing, as we know, in Boulder County can be kind of complicated, and we're not seeing great figures here from our respondents to the COSOA survey. So having housing to suit needs has stayed about the same. For a variety of housing options, this has dropped 16 points over 8 years, so that's why this is a big arrow. It's a pretty big decrease. Availability of affordable quality housing, that has decreased 17 points over 8 years, so that's a really big drop for folks as well. We want to make sure that this is one of our priorities, especially through our AARP domains and in our strategic planning going forward. All right, care options. Now, again, I want to remind you that this is all respondents answering this question, and they may have not had to tap into these services yet. So we'll be able to drill down into that data a little more. But for now, the availability, about a third of people say that that's at least a minor problem for them. And we'd like to see this bump up, and this is another tool that we want to look into. We want to look into our communication of what's available in this community for people that maybe they just don't know about it yet. We don't want to get at this when it's a crisis point. We want people to know ahead of time what they can access. Transportation, also, we've heard from folks that this is a really big issue in Boulder County for older adults. So ease of getting to places visited in the community, held about the same, travel by car, about the same, and ease of travel by public transportation, it has held about the same, but that's at 40%. Again, this is something we want to look at folks who access that anyway and how they feel about it within there. So this is something we're going to dig into a little deeper as well. All right, caregiving. So this data was not gathered in 2010. All of these are ones that were listed as at least a minor problem. This question is not limited to our caregivers only, so we will be getting at that data, which is why I've given it kind of a meh emoji, is like, I want to know specifically from caregivers how they're feeling. But of all of our respondents, this is kind of held steady over time, that 17% are feeling physically burdened, 22% emotionally burdened, and 15% financially burdened by their caregiving. Okay, physical health, maintaining a healthy diet. So this is at least a minor problem for 35% of the folks who responded in Boulder County. And this is something that we can address. We know that the resources are there, and some of this is about communication and connecting folks to resources. Availability of affordable quality physical health care. This one has decreased 9 points over 10 years. So we'd like to see that increase, and I think we're doing a lot of that through our partnerships in the Area Agency on Aging. For mental health, all of these are holding steady over time. Again, these are all very important to us in our community and making sure they're connected with the resources that they need to get the mental health care that they seek. Okay, one more data slide. Here we go, healthcare. Affording needed medications is staying about the same over time, over the 8 years, and finding affordable health insurance, again, is holding steady over time. So I hope after you've seen some of this, and maybe the emojis were helpful or the arrows, that you feel the ability that you can jump right into this data. And if not, I want you to contact me if you have questions or if you're looking for information on specific age groups or specific to your municipality. And I want to talk to you a little bit more about that. I want you to use this data carefully. I mentioned Appendix A in the CASOA report. That's something to really refer to as you're going through this, to see exactly how those questions were asked and to see a better breakout. The CASOA looks at more than just health status and health insurance, but does a more holistic assessment of the experience of older Coloradans as we age. Now, next up, our folks from Colorado Health Institute are going to be talking about the Aging Vulnerability Index. And it does the same thing as this, for sure. And you can use this data in your strategic planning efforts, if you're looking at expanding or shifting the programs that you have already, and in your grant applications too, to help you secure funding for programs going forward. I want to tell you a little bit more about how this fits as well into our Age Well strategic plan. So this data was just released October 18th. We will be releasing our community conversations report in November. So that was when we went out to the community. I think there were 22 conversations. So just a summary of what those conversations said and really drilling down into more of the needs of the community. The Key Informant Survey has launched and is open right now, and I'm going to give you the URL for that in a second. But that's an opportunity as an organization to let us know what you think is needed in your area for older adults. So I'll be doing some secondary data analysis in the first and second quarter of next year. We'll be releasing a trends style report at the end of the second quarter of next year. And we're going to come back out and ask folks, what does this look like on the ground? What do you want to see for your community? We're going to go back and do some edits and further analysis beyond that. And then we're going to have the Age Well strategic plan hopefully released by the end of next year, hopefully at this conference. All right, so the key informant survey, this does take some time. It takes about 15 minutes, especially for those of you who provide lots of direct services to older adults and caregivers. I'd love for you to share this wide, share it with your staff, share it with other providers. You know, we want to hear from the community, and this really helps us put together our Age Well strategic plan and get ready for the next 4 years. And that is all I have. Any questions? Okay. Oh, yes.
Is there any plan to include about the communities of Boulder County in the surveys?
So the mountain communities were included in the community conversations, and I understand that they were included in the CASOA as well. But we'll be coming back around as well and having some strategic conversations with mountain communities and other municipalities. Yeah, absolutely.
Lindsay, they couldn't bring out the mountain communities for CASOA because we don't have enough respondents. So that they can't get a statistically valid projection. So we definitely included in there.
Okay. Well, thank you all so much for your time.
Great. Do you want to introduce yourself? Okay, hi everyone, good morning. Thank you so much for having us here today, just kind of as a little reintroduction. So Carrie, thank you so much for the introduction, but just to give you a sense of who we are, just like a little reminder. My name is Emily Johnson. I'm a director with the Colorado Health Institute. I have a background in statistical research, so I do a lot of our quantitative and economic analyses, and also part of my portfolio focuses on aging and aging-related health issues in Colorado. And this is my colleague, Adriana Gomez.
Hi everyone, thank you for having us. My name is Adriana Gomez. I'm a research analyst at the Colorado Health Institute, and a lot of my research revolves around specialty services and doing key informant interviews, as well as working with the aging population in Colorado. So to get us started, who has heard of the Colorado Health Institute? That's a big majority. So for those who haven't, just a little background, we are a nonprofit, nonpartisan research group, and we really believe in using evidence and analysis to drive healthcare policy. And we think that good healthcare policy leads to having a healthier Colorado. And so I know today you're probably going to sit in on a lot of presentations, you're probably learning a lot. So if you don't remember anything from our presentation, I really hope you take away these 3 key takeaways. The first is that Colorado is aging. So we're having a growth in our older adult population, and that brings both good news and also brings some challenges. So the Colorado Health Institute created an aging vulnerability index, and this index helps to identify the communities that are at the greatest risk in Colorado. And 3, the trends in long-term services and support and housing also have big impacts on the aging population in Colorado, and so we'll talk a little more about those. So we are living longer now than ever, and this comes with new opportunities. And so I just wanted to ask you all what you think the U.S. life expectancy was 100 years ago. So what do you think the life expectancy was in 1918? Any guesses? 40. 47. You hit it right on. So the life expectancy was 47 in 1918. Now, any guesses for what that life expectancy is today? I hear 83, 86. 82. You guys are very generous. The life expectancy is 79. And so we actually in Colorado have one of the counties that has one of the longest life expectancies in U.S., so that's Summit County. And so when we think of Summit County, you can think of towns like Breckenridge, Copper Mountain, Keystone. And so Summit County has very high life expectancy, and that could be attributed to the 2 things. They're very well off, and they're very educated. And so now that we are living longer, that also comes with a shift in demographics. So currently in the United States, Colorado has the third fastest growing older adult population. And so does anybody want to take a guess on who beat Colorado? So we're the third, but any other ideas on the two states that grew faster? Florida. Arizona, Alaska. I heard Alaska somewhere. So yes, it was Alaska and Nevada grew faster than Colorado did. And so it's estimated by 2030 that 1.3 million of Colorado residents will be 65 and older. And so that's a 77 increase to our current residents that are 65 and older. Now, those that are 65 and younger, their population will only grow by 20%. And this is expected because of the baby boomers. And so Colorado also is currently the sixth lowest in terms of percentage of 65 and older residents. So even though our 65 and older residents, the population is growing fast, we still have the lowest percentage of them overall in the United States. And we can think about this. Colorado has been historically a young state. And so this also brings challenges because Colorado doesn't have the infrastructure or the systems to support our aging population. Okay, and also in terms of talking about shifting demographics, specifically to Boulder County, the older adult population here in Boulder County has grown by 68% in the last 10 years. This is compared to 53% for Colorado, so we can see that growth more in Boulder County. And Boulder County is the 16th fastest growing county in terms of older adults, so it's not really in the middle, not really in the front, kind of somewhere in between there. So a challenge that comes with our growing population is that it comes with a price tag. And so if you look at this graph behind me, it shows Medicaid expenditures for long-term services and supports used primarily by older adults. And long-term services and supports include things like nursing home care and community-based services like home modifications. And so this graph shows both state and federal funding from 2018 to 2019. And so the last fiscal year, which was fiscal year 18-19, the spending was at 1.9 billion, and that is billion with a B. And so we can see that the costs are very staggering, and they're growing steadily. If you look from 2008 to now, we can see that it's just an upward trend. And so another reason we see the increase in cost is that we're also seeing an increase in enrollment in Medicaid services in the 65 and older population. In fiscal year 2011-2012, the enrollment was at 40,000. In fiscal year 16-17, that went up to 44,000. So we are seeing that increase in enrollment. Another challenge with the aging population is the cost of unpaid caregiving. And so when we think of unpaid caregiving, this is any care that maybe a child is giving to their parents. They're taking care of their older parent, or a niece, nephew is taking care of their aunt or uncle, or anything like that. And so CHI performed an analysis in 2015 and found that unpaid caregiving cost $3.7 billion. So all the bars added up together equal to $3.7 billion. The biggest chunk of that is $2.9 billion, and that goes to foregone wages. So any wages that a person didn't receive because they were providing care. The other factors are foregone benefits, caregiving expenses, or any type of healthcare cost to the caregiver. And so by show of any hands, who here has provided unpaid caregiving? So in Colorado, there is about 500,000 people who act as unpaid caregivers. So we can see how all those expenses start to add up. So the former chair of SAPCA said, there won't be just one solution because the state is so very different. We have cities, we have the plains, we have the mountains, and they all have different needs. And so in this quote, he acknowledges that solutions have to happen locally. We need local information, we need local partners to solve these issues because they really do vary from county to county, city to city. And so I will turn this over now to Emily, who will talk more about one of the data sources that CHI created to help solve this problem at a local kind of viewpoint.
Okay, so full disclosure, we're going to get into data now, and I have an infinity% fewer emojis than the previous presentation, so bear with me. But we wanted to talk about one of the tools that CHI created last year, maybe it was 2016, the years are flying by, called the Aging Vulnerability Index, which sought to answer the questions, which areas in Colorado, specifically which counties in Colorado, have the greatest concentration of people who are potentially facing health challenges or in need of long-term services and supports across the state. And so the index sort of scores counties or indices counties on a scale of 1 through 10, trying to indicate how, what kinds of challenges those counties might face. And so one big caveat here is it's really hard to boil down what's going on in different counties across the state to just one number. And so we really do kind of look at this as a starting point for maybe launching some of these conversations. And one thing I was really thinking about during Lindsay's presentation was there's all this really rich data that explains a little bit more of this story, that maybe we can start looking at how we can marry these two narratives. But also, we're going to be looking at some data for Boulder County specifically. A lot of you guys live here and work here, and so really want to, if we have time at the end of this presentation, hear any feedback that you guys have in terms of what resonates, maybe what doesn't, and what some of those narratives might be that can explain these numbers a little bit more. Both in Boulder County or elsewhere, if some of you guys don't live or work here. And so when we look at the index, we really tended to look at two different sort of areas of indicators that fed into this. One was risk factors. So what places people at greater risk as we get older? And so a lot of that is having a lower income means you just have fewer resources. A lot of times it's harder to save up for retirement, et cetera, and those kinds of risk factors. And we'll look at exactly what we included in just a moment. But then we also wanted to include needs. So sometimes those risk factors actually then turn into the need for different types of services. So looking at the percentage of older adults who maybe have difficulties with activities of daily living, such as self-care, et cetera. We selected the indicators that went into this index based on our review of the available literature and the available data. So when we look at risk, we wanted to first look at age. So how many people are there 80 or older living in different communities, because that does indicate greater risk factors for a number of things. Education, we know that, and this is true of everybody in Colorado, higher degrees of education tend to mean greater opportunities, both in terms of employment, but also better health outcomes, et cetera, even when you account for employment, increased health literacy, et cetera. Living alone, we, I think, as a community and as a country, have been talking a lot more about the intersection between living alone and health recently. So we wanted to include the percentage of older adults in each county who are living alone. And then finally, income. Working in social determinants of health, I think that we all know a lot of this often does come down to income and the resources that are available to people. So then looking at need, the different need categories that we looked at for the potential for additional long-term services and supports are cognition. So this is based on survey data that asks people about, do you have problems with memory or, remembering things? People who struggle with hearing. So do you have difficulties hearing, et cetera? Same question with vision. And then some of these sort of activities that you might find, especially if you're, could potentially a challenge if you are looking, as many of us hope to do, to age in your home or in your community. So walking in stairs can be a challenge. A lot of houses, I think of, my aunt who lives in a home that's 3 different levels, and that was built in the 70s. That was kind of a popular style then. So that could end up being like a challenge for her as she ages in her home. Independent living, so are there things that get in the way of your ability to live independently? And then self-care, this includes, kind of daily chores as well as bathing, et cetera. And here's a map that shows that overall index score. And so again, that's sort of synthesizing both those risks and the needs of older Coloradans. And you can see that overall, it's a lot of counties in southeast Colorado and the San Luis Valley. So Saguache, Huerfano, Alamosa, et cetera, that have a lot of the, both the greatest concentration of older adults, but also the greatest concentration of some of those need and risk-based factors among older adults. And then you see some areas, I think especially in the mountain counties, that are a little bit lighter on this index. Park County, I believe, has the lowest score at 1.6. Other standouts include Summit County, which Adriana mentioned earlier, is also the county in the United States with the highest life expectancy. And Douglas County, just a couple counties south of here at 2.1. And so for state officials, our hope with this was that it might help start a conversation with knowing sort of where to prioritize. And so looking specifically at those that ranked sort of in the top and the top 5 and the bottom 5 groups, when looking at this index, we see Otero, Baca, Crowley, Conejos coming up as some of those counties that might have the most challenges to face when they're looking at how to make sure that they're caring for everybody in their population. And then again, you kind of saw this reflected in the map, but a lot of those mountain areas, Park, Summit, Clear Creek, Eagle, and then also Ouray is up there too, that might sort of score on the other side of that index. When we look at Boulder specifically, the score is 3.8, which places, again, not quite at the top, not quite in the middle, but somewhere in between 18th and the 64 counties, that's a new term, counties in Colorado, in terms of looking at challenges that older adults might face. And then when we break this down a little bit more and look specifically at those risks versus need, I think that we start to see a little bit of a more interesting story because when we look at those counties that score the highest in terms of their risks, so these are areas, Kiowa, Washington, Baca, Cheyenne, Prowers, Rio Blanco, these are places that don't necessarily, all the bolded ones don't appear in the top 5 counties in terms of the overall index score. And so we do see a lot of areas that have built systems and have systems in place that might help protect people who might otherwise be in need of services from actually then needing those services. And we're not sure exactly what it is that happens there that might make this translate the way it does. And so those are kind of the stories that we look to solicit as we go through and we talk about this with folks. And just kind of, again, as a reminder, the risk factors are those things like income, education, et cetera. Again, when we look specifically at Boulder County, we're at a 3.8. That's not a typo. It's actually the exact score for both the overall score, the risk score, and also the need score for Boulder, so a little spoiler alert. And so, again, this is about middle of the pack in terms of where the counties fall. Then finally, when we look at those need-based factors, so again, these are things like hearing, cognition, self-care, et cetera, we do see a lot of that need being most acute in the San Luis Valley and in the southeast of Colorado, and that's where we saw a lot of the overall scores kind of pop up on that map. And so if we look at what counties don't appear in the top 5, when we look at need scores, it's really just Lincoln. So this tends to align a lot more with the overall score. So it's I think, an interesting dynamic that it really seems to be these kind of higher need-based factors that are driving that overall status of areas. And that kind of makes sense, right? Because that's when something has been actualized. You have risk, but then need is when it's actually there. Again, 3.8 for Boulder. I kind of thought that it was interesting to see. I kind of kept thinking this was a typo, but all 3.8s all around, which puts it in kind of the top third in terms of the least vulnerable counties in the state. And so when we look at county details, they can provide some different insights. So I think that, again, behind these numbers is really where that real story is. So the index also includes data that's specific for each of these 10 factors. We have interactive maps on our website where you can go and sort of see how different counties are looking, these areas of strength and these areas of maybe more need. And so the solutions might look a lot different depending on sort of what those factors driving are. And so one really interesting thing I noticed when comparing Boulder County to Gilpin County, for example, is the percentage of adults that live alone varies a lot. Colorado, around 40% of older adults live alone. That's pretty high compared to a lot of other areas of the state. You look somewhere like Gilpin, that number is closer to only 1 of 4. But then if we look at something like education, that kind of, might drive these kind of counties in the opposite direction in terms of what the potential risk for needing LTSS support is. So only 1 of 25 older adults in Boulder County does not have a high school diploma. Again, that's one of the lowest rates in the state of people who don't have a high school diploma, whereas more than half of people who live in Gilpin County that are over age 65 don't have a high school diploma. And so the way that you might want to address these two different dynamics that are happening in these two different counties might be different. And so when we bubble it up to a score, we want to start a conversation, but of course that doesn't tell the whole story. Adriana read a quote earlier from the former chair of the SAPCA, the Strategic Action Planning Group on Aging. And I think that this really speaks to that there are local issues and they need local solutions, local priorities, et cetera. Again, another way that we can kind of look at these different counties and how they might provide different insights is comparing, again, Boulder to another county, Costilla County, down in the San Luis Valley. In Boulder County, it's only a little more than 1 of 10, that's maybe one of 9 older adults have serious difficulty hearing or say that they have serious difficulty hearing. It's more than 1 of 3 in Costilla County. And so some of these different need factors can look very, very different in these communities, and what you do to support people can look very different as a result. As I mentioned earlier, again, we look at cognition as well as one of those potential need factors. About 7% of older adults in Colorado say that they are struggling with memory or decision making, and that jumps up to almost 1 of 4 in Costilla County. So again, really, really different ways that people are experiencing different needs in different areas of the state, and so that will have different solutions, which isn't to say that the state doesn't have a role in solutions overall, but I think that just to say that there's an extremely important role for local community solutions. And the last thing we wanted to just touch on quickly today is when we talk about wanting to grow older in our homes around according to the ARP, I'm going to get the percentage wrong, it's somewhere in the 80s. I think it's 84% of people, we say that when we want to grow older, we want to grow older in our homes. That's where we want this to happen. That gets really, really challenging when we are talking about living in a state, and specifically living in some counties with super quickly growing rates of mortgages and rents. And I'm sure any of us who have a mortgage or a rent have felt this in the past 10 years. And so one way we can look at housing affordability across the state is to look at what percentage of people in different parts of the state are spending more than 30% of their income just to be in their homes. And so this is a map of looking at homeowners or renters who spend more than 30% of their income on housing. I apologize, I kind of didn't realize how small it would be once it was up on the screen. But if you can see in the dark blue, those are areas where more than a third of people are spending more than a third of their income on housing or rent. That doesn't leave you with a whole lot of money for every other thing that you need in your life, food, medicine, et cetera. And so especially in some areas like Summit, you really see that popping up, probably because a lot of the housing there is really expensive, but you also see it popping up in places like Alamosa and Huerfano, where it's probably just because people's incomes aren't quite as high there. And so it's really, while housing might feel more affordable, if you're not able to make the income to make that affordable in those areas, you're faced with real challenges. And so CHI is currently doing a lot of work looking at the issues related to housing, not just in terms of affordability, but also in terms of accessibility, because it's more than just can you afford a home. So when it comes to Coloradans in general, home is a setting of care. And I think that we need to acknowledge that and understand that and know how we can support people being where they want to be. It's also not just housing that tends to be out of reach for a lot of us. So specifically, we decided to pull some data for Boulder looking at the average income of older adults in Boulder. It's around $25,000 per year for the average household led by an older adult in Boulder. And so if you remember when we talked about Summit County having the longest life expectancy, it also has the highest premium. I don't know if this is still true, but 2 years ago, it had the highest premiums for health insurance on the individual market in the country. So that's kind of this weird paradox. It's this very healthy area with this awesome life expectancy. It's super expensive to buy health insurance. And so things within the system can also impact people's ability to get the care that they need as well. So if we look at $25,000 in Boulder County, if you were trying to get adult day services based on that income alone, oops, spoiler alert, that's around 70% of your income that you'd have to spend every year to be able to afford those services. Assisted living, you're now at 2.5 times that income. And again, these are all data specific to Boulder County. Home health care costs are, again, about 2.5 times as much as the average income for an older adult in Boulder. When we start looking at nursing, skilled nursing, it jumps up even more to about 5 times that average income for 1 year of either a private or semi-private skilled nursing care. And so sometimes when we talk about housing, for example, and I say more than 30% of your income going to housing, that forces tough decisions. This is even sometimes beyond for a lot of people tough decisions. This is just, impossible. Yeah, really difficult. And so when Adriana shared that slide earlier, when we looked at unpaid caregiving and the economic burden for unpaid caregivers in terms of lost wages, et cetera, those additional healthcare costs were really just those additional healthcare costs to the unpaid caregiver themselves, because since you have these pressures from jobs, et cetera, we do see that there are higher rates of disease burden among caregivers themselves than there are in the population who's not providing caregiving. So that doesn't even include, the additional support that you might be providing to help people get the care that they need when it's kind of this out of range for a lot of folks. And so on that note, just to kind of revisit our 3 takeaways before we turn it over, again, we'd love to hear questions as well as any thoughts that you all have on the information here and what might be kind of going on. Again, we are seeing our older adult population grow. That's really good news. We're living longer, we're living healthier lives, but it also does bring with it some new challenges for us. We've created this vulnerability index to try and help start some of those conversations around where we might be seeing communities in the state face those greatest health challenges. And again, that's a lot in Southeast Colorado, San Luis Valley. And then to keep in mind that this isn't just a sort of isolated thing, that there are trends in both LTSS costs as well as housing costs that are impacting everybody in Colorado, but I think interact with us as we age in pretty unique ways. And so that is the end of our presentation today. Yeah. Thank you guys so much for joining us. And yeah. And I think I saw, hi. This one? Sure. No, that's a great question. So in case anyone couldn't hear it, the question was around if we've looked at Medicaid dollars by county. So we haven't, and this is actually from the Genworth cost of care study, so this is really looking at the private pay side. We haven't done anything on Medicaid dollars by county. We are currently doing some work with the SAPCA that's looking at expenditures through Medicaid as a state, and how that also relates to different sort of settings of care, different programs, PACE versus home and community-based waiver, et cetera. And I'm sorry, I shouldn't say just Medicaid. We're also looking at the Department of Human Services expenditures. But no, we haven't. But that's a great question. So would you be interested to see sort of how Medicaid might be sort of complementing the private industry in different parts of the state, or?
Well, I think there's the Medicaid complement, and I also think there's several organizations here today who also are doing their own dollars.
Okay.
Folks meet those costs, whether it's the AAA or foundations. So I think we're all struggling to try and figure out how to help people access some of those services.
Yeah, that's a great point. Thank you. Okay, sir.
You talked about Medicaid expenses. Does that include Medicare, or is that just purely Medicaid?
That's purely Medicaid, so that's a great question. So Medicaid, yeah, it covers, most long-term services and supports are covered through Medicaid. So that was just looking at the Medicaid expenditures in the state. And that combined, half of that does come from the federal government. So really Colorado's cost, it's about half, just basically divided by half, but yeah, it's just Medicaid. Hi. Sure. So sorry, so I probably should have oriented this slide a bit better. So these are all basically how much of that 24,903 is, like how much larger, or in this case smaller, that 24,903 is compared to what the average annual cost is. So the average annual cost of adult day services is about 0.7 or 70% of 24,903. So that's 17,000-ish. Sure. Exactly the slide you're talking about. There's just a lot of animations. Sorry, so give me a sec. This one? Yeah. So the data for this were taken straight from the American Community Survey. So I think, kind of per Lindsay's point earlier, I'll sort of refer back to the question that they ask in terms of how this response is defined. So people are asked on the American Community Survey, which is an annual survey done by the census, do you experience limitations with independent living, including Oh, you know what, actually, let me get back to you on that because I might mess up the exact phrasing and I want to say what exactly it is. But I believe this was more like meal preparation, et cetera, and self-care had more to do with bathing, et cetera. They give a couple examples. Oh, Adriana knows. What was it?
So another one that includes is the physical, mental, and ability to run errands, your ability
Run errands.
to prepare your own meals. So the things that like you're able to do when you're living independently.
Lifeline, thank you. I'm sorry, versus health things. Yeah, and so I assume that there are health things that obviously underlie that, but yeah, it's not, yeah, it's a little bit different from people reporting specific rates of diabetes, of specific illnesses, yeah. Hi.
What age range is this study based on? I thought I heard you say
So this is 65, yeah, sorry, I should have clarified that. This is 65 plus. When we look at age as a potential risk factor, we're looking at the percentage of people who are over 65 who are over 80. So that's where I said 80, yeah. Does that? Hi.
Have any data about access to mental health services, especially because we know that men living alone are at especially high risk of suicide?
Yeah, that's a great question. So in this, we don't, but we do have our own survey that we do every 2 years called the Colorado Health Access Survey. And as part of that, a question that we ask of everybody is, was there a time in the past year where you needed mental health care and you weren't able to get it? And we have started actually, and we also ask a number of questions about people's households so we can identify, and also gender and age, so we can identify, for example, if you are an older man living alone, we would know that from this survey. And so we have just started to dip our toe into looking at how different rates of not just mental health care access, but self-reported mental health status look among different communities according to the data that we've collected in the Colorado Health Access Survey. One big caveat I have to give there, though, is that this is all self-reported, and it tends to be, some studies have shown that oftentimes men, especially, won't tell a stranger on the phone or self-identify themselves on a phone as somebody who is in need of mental health care services. And so it doesn't really align that with, have they been diagnosed by a doctor, et cetera. So it's all self-reported, so there are some limitations to that data. But we are seeing, I think, some really interesting trends in terms of people who self-report that they have experienced poor mental health in the past month, and also people who self-report that they haven't been able to get to a provider to see someone about their mental health status. And also we ask about those reasons why. So we say, was it because you didn't think your insurance would cover it? Were you worried about what might happen if someone found out? And those also look very different, I think, when we look at different populations across the state. For example, we see a lot of rural areas, people are more concerned about what would happen if someone found out. That seems to be not necessarily because of a higher stigma, but because if you're in a small enough community, you know someone's car, and you know if it's parked outside of it. So that like kind of concern around somebody actually being able to find out is going to be higher in a smaller community where you recognize everybody's car. But yeah, we started to look at that. I don't really have anything to share with that now, unfortunately, but stay tuned in the next few months because we've started to look at that. Yeah. Hi. So we haven't spliced this by really anything except for, we've really just looked at age. We haven't spliced it by race or ethnicity or gender at all for this analysis. It is something we can look at. We do have a report, it is probably 2 years old at this point, on our site specifically about Hispanic and Latinx aging not in Boulder County, but across Colorado, and some of the sort of different dynamics that happen in different populations across the state, but we haven't. Yeah, I can't answer. I'm sorry. That's my long way of saying I don't have an answer. Sure, yeah. We're pretty open to whatever. So this is sort of our dog and pony show where we go around and we say what would be helpful to help people who are actually working in these areas understand. And so we haven't had any specific plans for that yet, but this is where we want to know if that's the kind of thing that would be helpful in terms of strategic planning and the work that you all are doing. So. And also, I do want to, quickly note that as part of our community benefit at the Colorado Health Institute, we're also able to pull together any data that take us fewer than 4 hours to pull together. So if there are any specific statistics you wanted to see for Boulder County, broken down by race, ethnicity, age, et cetera, please reach out to us. If it takes us fewer than 4 hours to do, we do it for free, and we're happy to do it. So, hi, take it.
Has there been any research on carrying this kind of data without care utilization data over time? So to look at
Yeah.
generate predictive insights based on like historical healthcare data and social service utilization data and demographic sort of personal profile data.
Yeah, there have been some really interesting studies done on that, not by us, but by groups that have access to claims data usually. So Tennessee, I believe, has released a study looking at sort of the predictive, like trying to predict the needs in terms of care utilization for people in their communities and trying to therefore be able to figure out what those increases in social services are that you can adjust to sort of alleviate that. Actually, just this morning, I wasn't there, so I'm going to steal Adriana's thunder, but she was telling me she went to a presentation at the Denver Metro Chamber of Commerce, right, where they were are you guys familiar with Project Angel Heart? I don't know if anyone, they're an amazing group. One of our colleagues is on the board there. They're great. They provide meals to people who, across Colorado who, who are oftentimes in their homes are unable to make meals for themselves. And so they work a lot with sort of cancer patients, HIV, AIDS, et cetera. And there are some efforts to now look up how we might be able to link private payers with those types of services, because sometimes it's those relatively low-cost services that can make a huge difference in terms of health outcomes. And so if that argument can be made to payers that by investing in, $4 a meal or something like that, they can realize sort of greater savings down the road because payers are businesses, that's something that they should do. So how can we sort of quantify expenditures on those social services in terms of longer-term health outcomes? So there are a lot of private organizations that are currently doing those studies. It's mostly, like I said, people who have access to claims data. So payers and also Medicaid is starting to look at quantifying, okay, how can we maybe offset future costs in terms of by providing more social services now? Because I think that there's there's an obvious health-based argument to that. And I'm like, of course, it's the right thing to do. But, payers are businesses. So they're looking at making those cost-based arguments too. But not by us, yeah. But there is some really interesting stuff out there. So thank you. I don't know, does anyone have any other questions, comments for, is Lindsay still here? Pick on her? No, she's not. Okay. All right. Well, thank you all so much. Please feel free to reach out to us with any questions or other thoughts. You guys have been awesome. I have a note of 8 things I want to research after this. So thank you all so much. I really appreciate it.